There is a yearning, I think, amongst my colleagues as to how to better integrate wellness aspects and really whole person aspects into treatment. And unfortunately, given the limitations of a traditional practice, they realize often that they can't do that. They can't impart their medical expertise and talk about psycho-emotional health, nutritional health, exercise health. It just becomes really outside of the realm of what's possible. Each person's unique. They come with their own set of idiosyncrasies, risk factors, habits, and really to be able to delve into that and do that justice, one needs to spend the appropriate amount of time to understand who is sitting in front of you. Being able to combine the personal story that I get from talking to the patient to being able to look deeper inside, so do more focused imaging based on their risk, look at their genetic drivers, both inherited as well as some of the molecular markers that might be flowing in biomarkers. We're able to focus on very early suggestions and snippets of cancer DNA or cancer cells that might be floating in different blood or different urine or sputum to give us a sense as to what's going on. What do we need to focus on? Based on someone's risk and exposure history, we can really start utilizing some of these more cutting-edge molecular and genetic technologies to better see what is their risk and do they have something early that we might have otherwise missed. My hope is that we're able to impact and implement those changes early enough so that they're meaningful and yield dividend that lead to better health and wellness. My name is Dr. Mark Levandovsky. I am a hematologist, oncologist, and internist. I am relatively multifaceted. I do emphasize a few things, but as an oncologist and hematologist, certainly looking at some of the more common cancers, why we develop them, and what we can do to lower that risk is one of my interests. One word I would use to describe my practice is personalized. Personalized concierge practice that looks at each person as an individual, that focuses on what constitutes their specific health portrait. It's my most genuine belief that that's how we need to treat people in medicine, to look at the whole person. And by so doing, we're not only going to be able to do our best in catching things early, but even more importantly, I think impacting someone's life and choices so that many things that can befall us could be ultimately prevented and not developed.